Earlier today, I obtained Shannon's vital signs for height and weight. They was all within normal limits. I assessed her gait; it was normal. She's dressed appropriately for the weather. Her skin is consistent with her genetic background. She's alert and oriented, and her speech is clear. Now we're gonna move into the head to toe assessment. We're gonna walk in the room. Hi, I'm Key. Your name, Shannon.
Yes.
Okay, good. Okay, Shannon. Today I'll be doing your complete head to toe assessment. First, I want to start off with your cranial nerves. Okay, we're gonna start off with cranial nerve 1. I want you to close your eyes, and I'm gonna include each nostril at a time, and I want you to tell me what it smells like.
Alcohol.
Okay, good.
Alcohol.
Good. Cranial nerve 1 is intact. Earlier today, we test your vision using the Snellen chart. Your vision is a 20/30 in both eyes, which means you can see at 20 feet, with a normal eye can see at 30 feet. Now we're going to move along to the confrontation test. I want you to simply put that in front of your eye, and I'm going to come from the back with my pen light, and I want you to let me know when you can see it.
Now. Now. Now.
Good. Keep it that way.
Now. Now.
Good.
Now.
Good. Cranial nerve 2 is intact. We're going to move along to cranial nerve 3, 4, and 6. Can you raise your eyebrows for me? Good. Now I want you to focus on my pen. I want you to move along with it, only with your eyes. And this is the 6th position diagnostic test. Good. Cranial nerve 3, 4, and 6 is intact. We're going to move along to cranial nerve 5. Can you clench your teeth for me? Good. Okay, now I want you to close your eyes and tell me when you feel something touching your face.
Now. Now. Now.
Good. Cranial nerve 5 is intact. We're going to move along to cranial nerve 7. Can you close your eyes tight for me? Good. Can you smile? Can you frown? Can you puff your cheeks out? Good. Cranial nerve 7 is intact. We're going to move along to cranial nerve 8. First, I'm going to start off with the whispering test. I'm going to stand behind you, and I'm going to whisper something. I want you to repeat it back to me. I want you to also close one of your ears. It doesn't matter which one.
ABC.
Good. Close the other ear.
1, 2, 3.
Good. Now we're going to move along to the Weber test. I'm going to strike my tuning fork, and I'm going to place it on top of your head, and I want you to let me know where you can hear it.
Now.
Okay, good. Now we're going to move along to the ringing test. I'm going to strike my tuning fork again and place it on your mastoid process, and let me know when you can hear it, and then I'm going to move it further in front of your ear canal, and I want you to let me know when you can hear it.
Okay. Now. Now.
Okay, good. I'm going to strike it through the other ear.
Now. Now.
Good. This lets me know that you can hear better air conduction along with bone conduction, which is what I was looking for, which is good. So cranial nerve 8 is intact. We're going to move along to cranial nerve 9, 10, and 12. Okay, can you say all for me? Good. You're using and soft hand and rolls at the same time. Now we're going to check your gut reflex. Okay, good. Now I want you to close your eyes. They're going to place something on your tongue, and I want you to tell me what it is.
Sugar.
Good. Can you say light, tight, dynamite for me?
Light, tight, dynamite.
Good. Cranial nerves 9, 10, and 12 are intact. Now we're going to move along to cranial nerve 11. I'm going to simply press down on your shoulder, and I want you to shrug resisting. Good. Now I'm going to do the same thing with your face. Good. Good. Cranial nerve 11 is intact. Now we're going to move along to the overall complete inspection. Do you have any tattoos?
No, ma'am.
Okay, good. Your skin is even in color. It's also warm to touch, moist with no dryness. Your head is stromocephalic. Now I'm going to simply begin a palpation, feeling for lumps, lesions, and abrasions. Do you feel any pain?
No, ma'am.
Okay, good. Now I'm going to move along to your sinuses, palpating your frontal sinus first. Do you feel any pain?
No.
Good. We're going to move along to your maxillary sinuses. Do you feel any pain?
No.
Good. Now we're going to move along to your neck. We're going to also palpate your neck, feeling for lumps, lesions, and abrasions. Do you feel any pain?
No.
Good. I'm going to also move along to your neck muscles, starting with your trapezius. I'm going to move along to your sternocleidomastoid. They're both equal in size. Now I'm going to simply check for skin turgor. You have good elasticity, which means you're not dehydrated. Now I'm going to do the TMJ test. Can you open your mouth for me? Can you close it? Good. I didn't feel any popping or crepitus. Now I'm going to do your lymph nodes. We have your preauricular, postauricular, occipital, submental, submandibular, tonsillar, superficial cervical. You have your deep cervical chain, your posterior cervical chain, and your supraclavicular. Now we're going to move along to your oral exam. Simply inspect first. Your lips are moist. I don't see any dryness or cracking. Can you open your mouth for me? Okay, good. Your buccal mucosa, your hard and soft palate, your anterior and posterior pillars, and your posterior pharynx are all pink and moist. I also see your Stensen's duct. Your tonsils are present, which is a 2+, and your uvula is midline. Can you lift your tongue for me? Okay, good. Your frenulum and your tongue are midline. I also see your Wundt's ducts. I don't see any dental caries. I don't see your wisdom teeth. Your wisdom teeth are absent. Looks like you have good oral hygiene. Okay. Now we're gonna move along to your ears, to your nose. I'm sorry. Okay, your nose is midline. I don't see any lumps, lesions, or abrasions. Okay. Can you go ahead and tilt your head back for me? Okay, good. Your nasal mucosa is pink and moist. Your nasal septum is not deviated. Your turbinates aren't swelling. I don't see any bleeding or discharge. Okay, good. Now we're gonna move on to your ears. Simply inspect first. Your ears are symmetrical bilaterally. We're going to start with a palpation. I'm going to first palpate your mastoid process. Do you feel any pain?
No.
Okay, going to move into your auricle. Do you feel any pain there?
No.
Good. I'm going to move into your trachea. You feel any pain?
No.
Okay, good. Now I'm going to look inside your ear now. I don't see any excess serum. Now I'm going to go a little bit further inside. Okay, your cone of light is present at 7 o'clock. Your tympanic midbrain is pearly gray, with no bulging or retraction. And I also see your umbo, your malleus, and your manubrium, which is good. And I will also do this for your right side. And your cone of light will be present at 5 o'clock. Now we're going to go ahead and do your eyes. I don't see any abrasions or lesions. You don't have any lid lag. Now I'm going to check out your lacrimal duct. I don't see any swelling or discharge. Now I'm going to do conjunctiva. They're both pink and moist, and your iris is brown, and your sclera is white. Now I'm going to measure your pupil size. Your pupils are 3 millimeters. Okay, now I'm going to move into the cover test.
No retraction or absorption.
Cover test.
And the corner block is in the 5 o'clock position in the right here. And
I'm going to simply put this in front of each of your eyes, and I'm going to move it quickly, checking for deviation. Looking for deviation. Good. I see no deviation. Now I'm going to do the corneal light reflex. I want you to look at the tip of my nose. Okay, good. I see reflection at the same spot in both eyes. And now we're going to check for perla.
Okay, good. Cranial nerve 8 is intact.
Good.
And now we have the Weber test.
Good.
And I'm going to just...
Now I want you to simply look at the dot behind me, and when I tell you to look at my pen light, I want you to look at my pen light and check it for accommodation. Look at my pen light. Okay, good. These tests tell us that your pupils are equal in size. They're round. They're both reactive to light, and they accommodate. Now we're gonna move along to your trachea. I'm first gonna palpate. Trachea is midline. Now I'm gonna move along around to the back, palpating your thyroid. And first, I want you to lean your head to the left and forward for me. Can you swallow? Okay, good. Lean your head to the left right and swallow for me. Good. I didn't feel any lumps or masses. Did you feel any pain? Okay, good. Now we're gonna move along to your pulses. We're gonna start with your brachial first. And I will check on the other side as well. I'm gonna move it down to your radial. Okay, good. Now we're gonna move along to your dorsalis pedis. And I'm gonna move it down to your posterior tibia. And I will check these pulses on both sides. Now I'm gonna check your carotids. Okay, good.
There was no tuning present.
Now I'm gonna go ahead and listen.
Let you know that you are not dehydrated and you are drinking plenty of fluids. And now I'm gonna just palpate and look at your trapezius muscle and your sternocleidomastoid muscles. They do seem to be even and symmetrical. Could you lift your shoulders for me? Okay, good. And
Okay, good. Your pulses are all a 2+, and I didn't hear any brewing. Now I'm gonna move along to the heart sounds. I'm gonna start with your aortic valve first.
your carotid arteries.
Aortic valve. I'm gonna warm it up for you. Thank you.
Okay.
Your aortic valve. Your right sternal border. Second intercostal space. Now we're gonna move along to the pulmonary valve, left sternal border, second intercostal space. Okay, good. Now I'm going to lift your shirt a little bit. In order to do the tricuspid and the mitral valve, you have the tricuspid valve here, left lower sternal border, fifth intercostal space. And we have the mitral valve, left mid-clavicular line, fifth intercostal space. Okay, good. I didn't hear any murmurs. I heard S1 and S2 sounds throughout. Now we're going to move along to your chest and breath sounds. First I'm going to inspect. Your thorax is symmetrical with an elliptical shape. Now I'm going to move around. Can you switch around for me? Okay, good. I'm going to simply start with the respiratory excursion test. And I want you to simply lean forward slightly. You take a deep breath for me. Good. There was equal expansion throughout. Now we're going to do the tactile fremetus test. Can you say 99?
99,
99,
99,
99.
99.
Good. I felt equal vibrations throughout. Now I want to do the CBT test to assess your kidneys. I'm going to simply, and I want you to let me know if you feel any pain. Did you feel any pain?
No.
Good. Did you feel any pain?
No.
Good. Now I'm gonna go ahead and percuss your back now.
There also, and now I'm gonna auscultate your lung sounds. And with every time you feel my stethoscope move, you can just take a real quick deep breath.
Good. I heard resonance throughout. Now we're gonna go ahead and do your lung sounds now. Starting from the back. Can you take a deep breath for me? Good.
Okay, good.
Deep
I
breath.
didn't hear any
Good. Deep breath.
adventitious
Good.
sounds, and the lung sounds
Deep
work
breath.
very bilaterally.
Good.
And if you could just
Deep
turn
breath.
this way for me.
Good. Deep breath.
I'm gonna go ahead
Good.
and auscultate
Deep
and
breath.
palpate
Good.
your lung
Deep
fields
breath.
posteriorly.
Good. Deep breath.
And auscultate.
Good. Deep breath. Good. Deep breath.
And again, if you could
Good.
just take
Deep
deep breaths.
breath. Good. Deep breath. Good. Deep breath. Good. Deep breath. Good. Deep breath. Good. Now you can switch around for me. I'm going to do your front. Deep breath. Good. Good. Deep breath. Good. Deep breath. Good. Deep breath. Good. Deep breath. Good. Now I'm going to get lower. Deep breath. Good. Deep breath. Good. Deep breath. Good. Deep breath. Good. Okay. Your lung sounds are clear to auscultation. I heard no adventitious sound. Okay. Now we're going to move on to your abdomen. You lay back for me. Good. I'm gonna lift your shirt just a little bit. Okay. Now I'm gonna simply inspect. The abdomen is flat. You have an inverted umbilicus. I don't see any abrasions. I don't see any striae or scars. Now I'm gonna start off listening to your bowel sounds in all 4 quadrants.
Resonance throughout, which means that there is no edema in the lungs and there is no fluid, which is good. And while I'm back here, I'm going to go ahead and do just a few tests. If you can take a deep breath for me in just a minute while I touch your back, and we're going to be checking for respiratory excursion. Deep breath.
Okay, good. I don't hear any bowel sounds. Now I'm gonna move along to your abdominal vessels,
Now we're going to be doing tactile.
starting with your aortic first.
Every time you feel my hands, if you could say 99.
I'm gonna move along to your renals.
Okay, good. I felt vibrations throughout, which is good, what I was looking for. And while I'm back
Now
here,
we're
I'm
gonna
going
move
to
down to your iliac.
tenderness test, checking your kidneys. You may feel a thud, but you shouldn't feel any pain, okay?
Okay, good. I hear no brewing.
Okay?
Okay, now I'm gonna simply start off percussing.
And we're going to be doing the abdomen assessment on you. I'm going to, if you could lay back, I'm going to first begin by auscultating your bowel sounds, and I'm going to split it up into 4 quadrants.
Okay,
Just by
good.
looking at your abdomen, I do see this flat bit of
Liver and spleen are dull. I hear tympany throughout your stomach. Okay, now I'm gonna do start with a light palpation, feeling for any masses, lumps, or distension. Do you feel any pain?
No.
Okay, now I'm gonna go into a deep palpation, feeling for organ placement. Can you take a deep breath for me? Good.
Okay, good. I did hear normal vowel sounds throughout, which looks good. And now I'm going to start
Okay, I don't feel any enlarged organs, your liver and spleen, I don't feel, which is good. Okay, good. And now you can sit up for me. I'm sorry. Now I'm going to go ahead and test for muscle strength. Okay, can you hold your arms up like this for me? Okay, yeah, I want you to push against me, pull against me. Good. Can you push against me? Pull against me. Okay, good. Your muscle strength is equal in bilateral and your upper and lower body. Now we're gonna go ahead and move into your deep tendon reflex. First, we're gonna start with your brachial. Have to break your butt, your bicep. 1, 2, 3. Good. Now we're gonna move along to your tricep. 1, 2. Good. Now we're gonna move around to your patella. 1, 2. Okay. Now I'm gonna do your posterior tibial. 1, 2, 3. Good. And I would do that for both sides. Your deep tendon reflexes are all 2+. Now we're gonna move along to your range of motion test. Can you stand up for me? Okay, good. Now I'm gonna simply stand beside you and place my hand on the back of your neck, and I want you to flex your head forward, extend. Now I want you to laterally bend to your left, laterally bend to your right. Now I want you to rotate. Good. I didn't feel any popping or crevices. Now I'm going to stand beside you and we're going to do your shoulders now. I want you to add up. And I want you to go in a big circle for me, circumduction. Good. Oh, now I want you to internal rotation, external rotation. Okay, internal rotation. Internal rotation. Good.
Sorry.
External rotation. It's okay. Good. I didn't feel any popping or crevices. Now we're going to do your elbow. Can you flex your elbow for me? Can you bend it? Good. Can you pronate? Can you supinate? Good. Now we're going to move along to your back. I want you to flex forward, touching your toes. Good. Extend. Now I want you to laterally bend to your left. Laterally bend to your right. Good. I didn't feel any popping. Now we're going to move along to your knee. Can you kick your knee forward for me? Okay, good. Can you bend it? Good. Okay, you can take a seat now. Okay, now we're gonna do your ankle. Okay, can you push the gas pedal for me? Plantar flex. Can you lift it up? Dorsiflexion. Now can you tilt it to the inside? Inversion. Tilt it to the outside. Eversion. Good. You have a full range of motion. You have full range of motion. Now we're gonna move along to the balance test. This is the last thing we'll be doing today. Can you stand for me? Okay, good. First we're gonna start off with the tandem test. And I want you to simply walk in a straight line heel to toe for me, 4 steps. Okay, go ahead. Okay, now walk backwards, straight line. Okay, good. Now we're gonna do the Romberg test. And I'm gonna simply stand in front of you. I want you to close your eyes, place your feet together. Okay, good. Good. There's some swing, but that's normal. And last, we're gonna do the sensory test to see now you have seat. First, we're gonna start off with graphesthesia. I want you to simply close your eyes, and I'm gonna take your palm, and I'm gonna draw a number inside your palm, and I want you to tell me what number I drew.
You seem to have full range of motion.
2.
Good. In stereognosis, I want you to close your eyes, and I'm gonna simply place an object into your hand. I want you to tell me what it is.
A coin.
Good. Okay. Can you do this for me?
Okay. And now we have just a few more tests.
Coordination. Okay, good. I'm gonna simply check my notes, see if I missed anything.
Some balance tests. Okay? If you could stand straight for me and walk heel to toe. This is the tandem walk, and then walk backwards. Okay, balance was good. And now we're going to do the Romberg test. I'm going to get on my watch.
Okay, we didn't
And ask you to close your eyes.
check for your red reflex.
Okay, 20 seconds up. And I did not notice any
Okay, what I'm gonna do is I'm gonna simply come in at a 15-degree angle, and I want you to continue looking forward.
if you could touch
Continue looking forward.
your thumb in a rapid movement and get progressively faster. Okay, good.
Okay. Your red reflex is present. Your optic disc is creamy yellow, and your retinal arteries and veins are visible and impaired.
You can hold your hand out for me and close your eyes and tell me what I put in there. Okay, good. And now we're going to do something called graphesthesia. If you could tell me what I brought with me. Okay, good. All that is normal. If you could sit back down for me, we're going to do some.
Okay, Shannon, look like this completes our head to toe assessment. It was nice seeing you, Tay. You have a good day.
Thank you.